What if I told you that the bacteria living in your gums right now could be driving your Alzheimer's risk, your autoimmune flares, your heart disease, and your doctor has absolutely no idea? We spend billions every year chasing symptoms, prescribing statins, suppressing the immune system, treating depression, and with antidepressants. And nobody is looking inside your mouth. The oral microbiome is one of the most complex ecosystems in your entire body, and it has a direct highway from your bloodstream to your brain. When that ecosystem goes wrong, those bacteria don't stay in your mouth. They travel, they colonize, and they ignite inflammation in every system you have. So today I'm going to show you what that means for your health and exactly what you can do about it. This is one of the most important episodes I've ever recorded. So stay with me. Welcome back to Let's Talk Wellness Now, the show where we uncover the root causes of chronic illness, exploring cutting-edge regenerative medicine, and empower you with the tools to heal. And I'm Dr. Deb, and today we're pulling back the curtain on something that almost every practitioner, conventional and integrative, is missing: the oral microbiome and its devastating connection to the systemic chronic disease that people suffer. If you or someone you love is battling an autoimmune disease, unexplained brain fog, cardiovascular problems, chronic fatigue, or neurological symptoms that nobody can explain, this episode could be the missing piece that you've been looking for. So as usual, grab your cup of coffee or tea, whatever helps you unwind, settle in, and let's get started on your journey for deeper healing.
Tired of being told your labs are normal, but you still feel terrible? At Serenity Healthcare Center, we don't chase symptoms. We find the root cause. Hormones, gut health, autoimmune conditions, chronic fatigue, brain fog. We use cutting-edge functional and regenerative medicine to get you real answers and a real path forward. This isn't your average doctor's office. This is medicine the way it was meant to be practiced. You deserve to feel like yourself again. Visit serenityhealthcarecenter.com to book your appointment today.
All right, welcome back, everybody. So let me ask you something. When you last saw your doctor, did they ask you about your gum health? Did they want to know if your gums bleed when you brush? Whether you've had root canals, chronic dental infections, or persistent bad breath? I already know the answer is no. Because in conventional medicine, your mouth and your body are treated as completely separate systems. You see a dentist for your teeth. You see a doctor for everything else. And nobody is connecting the dots. I remember when I was diagnosed with MS and I was uncovering every aspect of what could have caused this trigger to happen. And one of the things I found was the oral microbiome. And so I did testing of my own oral microbiome. And when I went to my dentist and I said, hey, I did this test and look at all of these different bacteria that are harbored in my mouth, I'm really concerned about this. And he looked at me and he said, don't worry about that. That's not a big deal. We all have bacteria in our mouth, except I had spirochetes living in my mouth. Spirochetes are the bacteria that cause Lyme disease. And I already had known that, but had I not known that and not known what to do about it myself personally, I don't think that I would have had the opportunity to get as healthy as I was able to because I knew how to connect the dots. And today's episode, we're going to talk about what it's like to connect the dots. And so here's what I want you to understand today. Your oral microbiome, the ecosystem of bacteria, fungi, and other microorganisms living in your mouth, is not a dental issue. It is a whole body issue. And when it gets out of balance, the consequences reach far beyond what your gums show. And here's why your mouth is so uniquely dangerous when the wrong bacteria take over. Your gut has a mucosa barrier, tight junction proteins, and a sophisticated immune surveillance system designed to keep bacteria contained. Your mouth has none of that. The tissue in your gums is thin, it's highly vascular, and directly exposed to everything you eat, breathe, and drink. This is why it makes such a great absorption for medication. But when pathogenic bacteria colonize that tissue, they have immediate direct access to your bloodstream. And I use this analogy with patients. You have to think of your gut as the kitchen. There are walls, there are doors, there's a security system between it, between you and the rest of the house, between the gut and the rest of the house. Your mouth, however, is the unlocked front door. And when the wrong guests walk in, they get to go everywhere. In my practice at Serenity Healthcare Center, I've been asking about oral health for years because I've learned early on how important that is to the chronicity of your illness if you have chronic dental infections or chronic gum disease, or you have a lot of fillings in there. And we recommend people see a holistic dentist if they're having a lot of dental issues. Because if we don't do that and you don't get your mouth right, it's very difficult to get the rest of the body right as well. And when patients are doing everything right, you're eating clean, we're balancing their hormones, they're healing their gut, and they're still sick, still inflamed, still suffering, that's when we start digging deeper into trying to figure out what are we missing. And oftentimes it's the bacteria in the oral microbiome that's missing. And you can do everything else right and still be sick. If your oral microbiome is a disaster, it's going to keep you from improving and getting the level of health that you really want to get to. Now, here's the question that we get asked quite often. Dr. Deb, how would I even know if I have an oral microbiome problem? And this is where we need to talk about testing, because you cannot fix what we cannot measure. So I think testing changes everything. And I want to talk a little bit about an oral DNA test today. Most dentists, and even well-meaning ones, are doing visual assessments. They're looking at your gum pockets. They're checking for inflammation. They're doing x-rays. But that tells you nothing about which bacteria are actually living in your mouth or whether those bacteria are driving systemic disease. And this is where oral DNA testing is a complete game changer. Oral DNA testing specifically tests like the oral DNA MyPeriopath panel. That's the one we recommend in our office. Uses a simple saliva sample to identify and quantify the specific bacteria species present in your oral cavity. We're talking high resolution microbial identification. This is how I found out that I had spirochetes living in my oral microbiome, in my oral membrane, that were crossing the blood-brain barrier, in my opinion, and causing me to get white matter disease. And I still had systemic infection as well. It wasn't just in my mouth, don't get me wrong. But as I was healing everything else, had I ignored the oral microbiome, I would have never gotten better as quickly as I had, because that would have been always standing in the way for me. And you need to find out exactly what pathogens are present, at what levels, and how significant your inflammation or inflammatory risk actually is. And this matters so much because not all gum disease looks the same under the microscope. Two patients can have identical clinical presentations and completely different bacterial profiles, driving completely different systemic risks. And one patient may have high levels of, I'm gonna totally badger this. This is terrible. Porphyromas gingivitis, the bacteria that most strongly is linked to Alzheimer's disease. Yes, this bacteria in your mouth is very strongly linked to Alzheimer's, heart disease, and rheumatoid arthritis. And another might have Fusorbacter, which is associated with colon cancer and preterm birth. And you would never know without testing this. And in our practice, when I have a patient presenting with autoimmune disease, cognitive decline, unexplained cardiovascular markers, or neurological symptoms that don't fit neatly into a diagnosis, the oral DNA testing goes on the list every single time. And what makes this testing so valuable is that it gives us a roadmap. So instead of treating blindly with a broad spectrum antibiotic that wipes out your good bacteria along with the bad, which, by the way, creates more dysbiosis, and sometimes we have to do that and we have to repair the gut on the backside, we can actually use very targeted precision protocols based on what's going on in the mouth. And here's what I want everybody listening to understand. Any practitioner can order an oral DNA test through a functional medicine practice. But if you are not a functional medicine practitioner and you're a patient, you can actually ask or request your doctor to contact the company to get you an oral DNA test, and they can do a consult with them when the result comes back if they're not sure what to do. You don't need a biological dentist to initiate this, although working with one is really ideal. Your oral DNA lab processes the samples and gives you a very detailed report. It's one of the most underutilized tools in functional medicine, and it needs to be in our standard toolkit for chronic disease patients. So let's talk about the specific bacteria that show up on these tests and what they're actually doing to your body. So these pathogens are actually hiding in your mouth. When an oral DNA panel comes back, the two names I look at first every single time are the Piriformes gingivalis and the Fusobacter nucleatum. Most people have never heard of them. Most doctors haven't either. But the research connecting these bacteria to devastating chronic disease is no longer fringe science. It's published, peer-reviewed, and impossible to ignore. So the Piriformes gingivalis, or P. gingivalis, is the primary driver of periodontal disease. It's a gram-negative bacteria that produces lipopolysaccharides, or LPS. It's a potent inflammatory molecule that when it's released into your bloodstream, it can trigger systemic immune response. And we're talking neuroinflammation, not just physical inflammation, but brain neuroinflammation, heart or vascular inflammation, joint inflammation. All of this occurs from the bacteria in your gums. And Dr. Stephen Domini's research published in Science Advances found that P. gingivalis and its toxic enzymes called gingipains in the brain tissue of Alzheimer's patients. Now, this is really crazy. I want to say this again. This Dr. Domini's research, published research in Science Advances, found P. gingivalis in the brain tissue of Alzheimer's patients, not just correlated with Alzheimer's, but physically present in the brain. And these bacteria migrated from the mouth, they crossed the blood-brain barrier, and was actively contributing to neurodegeneration. That research stopped me cold when I first read this. Dr. Emily Kosovo from Columbia University also found that P. gingivalis DNA inside arteriosclerotic plaque in the heart. That actual bacteria, not just inflammatory markers, but the actual bacteria living inside the arterial plaques in the heart, migrating from the mouth to the heart and contributing to cardiovascular disease. The Fusobacter nucleatum is equally alarming. This bacteria forms biofilms, protective colonies that are resistant to antibiotics. They're like a film, like the film you get on your teeth when you don't brush them. You kind of feel that funky film. That's what a biofilm is like. So the Fusobacter produces this biofilm that protects the bacteria that are there, puts a coating over the top of the bacteria, so it makes it resistant to the antibiotics and the immune attack. So this particular bacteria is linked to colon cancer, inflammatory bowel disease, and preterm birth. And it has an almost uncanny ability to invade tissue and invade your immune system. And here's the analogy that I like to use. Imagine your gums are the garden. And when the garden is healthy, you have a thriving, balanced ecosystem. Beneficial bacteria keep the pathogenic ones in check. But when that soil becomes depleted from sugar, poor diet, stress, nutrient deficiencies, the weeds take over, right? And that P. gingivalis and Fusobacter are the weeds. And once they establish, they choke everything else out. So what does conventional dentistry do about this? They scale your teeth, and they may prescribe a course of antibiotics, and then they send you home. They're treating the symptoms, the visible signs of the gum disease is what they're treating, but they're not addressing the terrain and the ecosystem, the why behind the dysbiosis and the weeds that grow back. This is exactly why the oral DNA testing is so critical, because you can see which specific pathogens are present and at what levels. And you can actually create a targeted protocol to shift the terrain, not just suppress the symptoms. All right, so let's now talk about the mouth-body connection, what research actually shows. So let me connect these dots in a way that your doctor has probably never done for you, because most of them haven't seen the research, or if they have, they really don't know what to do about it. Cardiovascular disease. Multiple studies have shown that people with periodontal disease have 2 to 3 times the risk of heart attack and stroke. The P. gingivalis colonizes the endothelial lining of your blood vessels in the heart, and it triggers a chronic inflammatory response. And this promotes the plaque formation and destabilizes existing plaques, making them more likely to rupture. When a plaque ruptures, that's when we develop the heart attack or the stroke. This is not a theory. This is published cardiology research. And yet your cardiologist is not asking you about your gums or the bacteria in your mouth. Neurological disease. So beyond Alzheimer's, chronic oral infections are linked to depression, anxiety, and accelerated cognitive decline. So when LPS from the oral bacteria enters your bloodstream, it crosses the blood-brain barrier and it activates microglia and the immune cells of the brain. That's what the microglia are. And activated microglia produce inflammatory cytokines, TNF alpha, IL-6, 1 beta, that these cytokines disrupt neurotransmitter production and damage neurons. And I have helped patients who have seen their depression lift after aggressive treatment of their periodontal disease. Anxiety has lifted, not from anti-anxiety meds and antidepressants, but from resolving the chronic oral infection that was driving the neural inflammation in the first place. And this is what root cause medicine actually does. So let's talk about autoimmune disease. And specifically, I'm going to look at rheumatoid arthritis, lupus, Hashimoto's. All of these have documented connections to oral dysbiosis. The mechanism in the molecular mimicry, the proteins on the surface of the oral bacteria that structurally resemble proteins in your own joints, your thyroid, and your connective tissue. And your immune system mounts a response against the bacteria and then starts attacking you. And Dr. Annika Askanas at Columbia has published extensively on the oral microbiome in lupus patients, finding distinct microbial signatures in people with active disease. And here's the thread that runs through all of this. Chronic low-grade oral infection is a persistent upstream source of systemic inflammation. And when you treat it, really treat it at the root, you watch the downstream symptoms begin to resolve. So this is really precision medicine at its core. This is what you do when you're looking for the root cause and you're trying to address the treatment of this whole species. When we come back from this word from our sponsor, we're going to talk about what can you actually do to restore your microbiome. So don't go anywhere.
If you've been following me for a while, you know I don't recommend things that I don't believe in. And that's why I'm excited to tell you about LEMD, a peptide company that I personally work with that's changing the game in regenerative medicine. Peptides are some of the most targeted, powerful tools we have for healing, supporting everything from gut repair and immune function to hormones, energy, and cellular recovery. LEMD makes it easy. Access to pharmaceutical-grade peptides with real clinical support behind them. Visit lem.com/drdebmuth to learn more and get started.
Back to what you can do about this problem. This is the part you've all been waiting for, because knowing there's a problem is only half the equation. Let's talk about what to do about the oral microbiome. So step one, of course, is get tested. Before you do anything else, find out what's actually in your mouth. Ask your functional medicine practitioner or biological dentist about oral DNA testing, specifically the MyPeriopath panel. Know your bacterial landscape before you start any protocol. This is precision for your mouth. Step two, ditch the harsh mouthwashes. Listerine, chlorhexidine, these are sledgehammers. Yes, they kill bacteria. And yes, Listerine is actually natural, but they kill all the bacteria, the beneficial species right along with the pathogenic ones. A sterile mouth is not a healthy mouth. You need a diverse, balanced oral microbiome. When you wipe everything out with a harsh antiseptic, the bad bacteria tend to repopulate faster than the good ones, and you end up with more dysbiosis, not less. Step three, use a targeted, clinically designed toothpaste. One of the products I recommend in my practice is Dental Sidin toothpaste by Biocidin Botanicals. This is not your average toothpaste. It contains a proprietary blend of botanicals, including berberine, oregano, black walnut, and thyme that are specifically formulated to address oral biofilms and pathogenic bacterial overgrowth without destroying the beneficial flora. It's designed to work synergistically with the body's natural defenses rather than overriding them. And for patients who test positive for significant pathogenic overgrowth on their oral DNA panel, this is often my first line recommendation for daily oral hygiene. You can find this through our full script dispensary link in the show notes. Step four is oil pulling. This is an ancient Ayurvedic practice that functional medicine has enthusiastically reclaimed, and for good reason. The practice involves swishing a tablespoon of high quality oil, traditionally sesame or coconut oil, in your mouth for 10 to 20 minutes and then spitting it out. It is very important to note you must spit it out. Don't swallow this. The mechanism is mechanical. The oil binds to the fat-soluble bacterial membranes and pulls them out of the gum pockets and off the tongue. Research has also shown that oil pulling can reduce streptococcus, improve the gingival health, and reduce inflammatory markers in your mouth. In my clinical preference for oil pulling is organic coconut oil for its lauric acid content, which has natural antimicrobial properties. And for more aggressive cases, coconut oil infused with a clove essential oil is amazing. Do this first thing in the morning before you eat or drink anything. Swish gently, don't gargle, and spit into the trash, not the sink, or it will clog your pipes. The other thing you can do is clove oil. This is step 5. Clove oil deserves its own conversation because it's one of the most underappreciated antimicrobial botanicals in oral health. The Eugene oil is the active compound in clove oil, and it has been shown in research to inhibit the growth of the P. gingivitis, S. mutans, and other oral pathogens. It is also an analgesic property, which is why your grandmother probably had clove oil in her medicine cabinet for toothaches. You can add 1 to 2 drops of food-grade clove oil to your oil pulling routine, or you can dilute it in a carrier oil and use it as a gum massage, especially for teething babies. One of the things that I like to do, because I'm always in a hurry, is I put 1 to 2 drops of clove oil on my toothbrush, put my toothpaste over the top of that, and then I brush. It is a potent essential oil. You do need to be careful not to use too much. It can cause an irritation. And you always want to make sure you dilute this. Always use a food grade or therapeutic grade. So doTERRA or Young Living are the 2 companies that I recommend for essential oils when they're going to be ingested internally. Step 6 is targeted oral probiotics. Yes, oral probiotics are real and they are underutilized. Strains like Lactobacillus reuteri and Streptococcus salivarius K2 are specifically designed to colonize the oral cavity and crowd out pathogenic species. These are not your standard gut probiotics. They're formulated to survive and thrive in the oral environment. I use these with patients who are actively working to restore their oral microbiome after testing showed significant dysbiosis. Step 7, optimize your nutritional terrain. Your oral microbiome is profoundly influenced by what you eat and what you're deficient in. Sugar is gasoline on the fire for pathogenic bacteria. Fermented foods support your beneficial species. Vitamin D deficiency is consistently associated with worsening periodontal disease. Dr. Joan Lab's research has shown this clearly. Vitamin K2 is critical for gum tissue health and calcium metabolism. CoQ10 has been shown to support gum tissue regeneration, and omega-3 fatty acids like EPA and DHA directly reduce gingival inflammation. These aren't optional additions. These are foundational. So step number 8, work with a biologic dentist. A biological dentist understands the mouth-body connection. They're not just looking at your teeth. They're assessing your oral microbiome and pH. All right. So here is the bottom line. Your oral microbiome is your body's canary in the coal mine. It's one of the first places that systemic dysfunction shows up. And if you treat it like a cosmetic issue, if you brush twice a day and go to your regular dentist twice a year and call it done, you may be missing the root cause of chronic conditions that have nothing to do with your mouth on the surface. Measure it, treat it, support it, and watch what happens downstream. Thank you for joining me today on Let's Talk Wellness Now. If this episode opened your eyes to something you've never considered before, share it. Send it to your friend with autoimmune disease, your family member who can't shake the brain fog, your sister whose heart health numbers don't make sense. Because what's happening in the mouth is not staying in the mouth. And more people need to know that. Remember, wellness isn't about feeling good. It's about getting to the bottom of why you don't. If you're ready to explore how functional medicine and oral microbiome testing can help you find the root cause of what you've been dealing with, visit serenityhealthcarecenter.com or reach out to us directly. Until next time, I'm Dr. Deb, reminding you to take care of your body, your mouth, and your mind. Be well, and I'll see you on the next episode.